I lost myself. I remember just not, I don't think I did it on purpose, just trying to
It
navigate
happens.
a practice, breastfeeding, husband,
Oh,
and myself. I was stretched thin. It was after my birthday. I just turned 36. And I was just like, I'm just tired. Like, I'm exhausted. I just can't, there has to be more than just existing like this. And I remember saying, I had to remind myself, what did I usually do? Like, I've been in residency, tired, busy in med school. What kept me going has always been fitness. And I didn't realize that until now.
welcome back to Musings of a Geriatric Mama. I'm your host, Kedna Amey, and today's conversation is all about prioritizing your health as a mother, something we so often push to the side. Dr. Francesca Alcide, affectionately known as Dr. D, is a board-certified family medicine physician committed to helping individuals and family live vibrant, healthy lives. A proud graduate with a doctorate of medicine, Dr. D brings compassion and clinical excellence to every interaction in the exam room and beyond. She's a dedicated mother and wife, balancing her professional life with a deeply rooted love for family. Dr. D is also an active member of Delta Sigma Theta Sorority Incorporated and proudly affiliated with the Haitian Doctor Network, where she uplifts and empowers others through service, cultural pride, and education. Beyond the white coat, Dr. D is a passionate advocate for wellness and movement. She's an enthusiastic member of a thriving fitness community, embodying the belief that physical activity is not just a habit, it's a lifestyle. Whether she's lacing up for a workout or motivating others to prioritize their health, she leads by example and heart. Through her platform, FrantheMomDoc, Dr. D shares insights on motherhood, medicine, and maintaining balance, especially for women navigating the complex intersection of ambition, family, and self care. Her journey inspires others to redefine what it means to thrive in every season of life. She's passionate about helping women understand that taking care of their body isn't selfish, it's essential. This episode is going to empower you to see wellness in a whole new light. Welcome, Dr. Francesca Alcide, also known as Dr. D. I am so glad that you are here, that
Me
you took
too.
time in your busy schedule seeing patients and jumping right in to be
Yes.
able to provide insight and impactful information for our audience that is not only evidence-based, but that is practical, especially for busy moms. So I cannot wait to take a deep dive into this conversation because I realize motherhood sometimes just causes us to completely forget ourselves because
Mm.
we're prioritizing our children and our family so much. So I cannot wait for the wisdom that you're going to impart on our listeners. But before we get into that, I just want to ask about who Dr. D was before she became a mom.
All right. Who was I before I became a mom? I was Fran. I've always been Fran, born and raised in Miami,
Hey,
born
305.
a Haitian parent. So Fran has always been one who loves school,
Mhm.
very social. You would say, I know everybody in Miami. I think we met one time at
A
a
social
bridal
gathering.
show or a bridal
Yes.
show, and then through another mutual friend.
Yes.
Such a small world.
Small world.
But you literally before um, becoming a mom, I was a physician. Before
Hmm.
that, I was just on the grind, right? Just pursuing a dream that I've had since I was 5 years old. And to tell you, of course, I grew up Haitian. You would think, oh, my parents would be a doctor. They did not. I don't know where it came from, but at 5,
Mm,
I just said I was gonna be a doctor. And
amazing.
sometimes when the days are hard, I have to remind myself that you prayed for this. You
Mm,
asked God for this and he's giving it to you. So when the days are hard, I have to remind myself that this is what I wanted.
yeah.
So so before then, school. I've been in
Yeah.
school with church. I've always been part of church and ministry. I'm a part of my sorority as well. So I've just been a girl's girl for the most part
I love that.
before being a mom. And then, of course, being a physician as well.
Ooh, I love that. So to me, it sounds like education has always been a priority for you. From
Yes.
young, you kind of already knew. You were ambitious from the beginning up until now. But
Yes.
another thing I heard is It sounds like you know how to incorporate a little bit of balance as well because you were outside,
I
okay?
was, I don't know. I've always been one. I kid you not. I remember back in like what we call our clubbing days. I would finish my papers right before 12. You know, mine, we partied late. So 12 o'clock, you have time to get ready. So just finishing papers before 12, having a good time, and then back to the grind. And my friends will
Yeah.
always be shocked when I got into med school. It's like, how did the girl who partied at the time get into med school? Because when I tell you I was outside all the time, and this is back in so I got into med school 2012. So, you know, back in the
Oh, yeah.
2009, like 2012, like that
Hmm.
era, we were outside.
We were outside. We were outside.
So it was just interesting people to see me like, how did this girl who was at all the parties, the festivals, get into medical school? Because
Mm,
I don't know. I've just always been one to know that I got to know what's important at the end of the day.
yeah,
I can have fun, but I got to take care of business.
I love that. And I think our cultural background also um lends to that
Yes.
we know how to it's imparted on us how to prioritize. But I love that because sometimes when, and I guess we'll talk a little bit more about when you finally got into your, embarked on your motherhood journey, but when we become moms we kind of lose a little bit of that. That's why I
Hmm.
always lead in with that question because there's such a big identity shift that happens.
Oh,
And um and reclaiming some part of that back, I feel like is
mhm.
so important,
It
even if
is.
it's not exactly the same. So we may not be out and about all the time, but
Correct.
we can still understand the girl that enjoyed life, with vibrance.
Yes.
That person
Yes.
isn't gone. This is just a new level, an evolved version of the girl we were before. So I
Correct.
always want to start with that question because I think it's important. And from what I'm understanding, you were always ambitious, you always had vision. And how did you end up in medical school to become a doctor? This is what you were predestined to do and to
Yes.
be.
Yes.
So, I'm so excited. We're about to dive in. But before that, tell
Yes.
me a little bit about when it was finally time for you to become a mom, how that happened, and how
Woo.
old were you when it happened?
Okay.
So
So
not
I was
details exact because we know, I'm not
okay.
gonna say.
So 33 years old is when I
Okay.
found out I got pregnant. So my husband and I got married in 2019. I had just moved to outside of Atlanta. I'll say in a small city called Kennesaw, like 30 minutes from Atlanta.
Oh, yes.
And I was on birth control for a very long time. And COVID happened, right? So COVID
Yes.
happened around March. And I said, you know what? We were planning a trip that summer to, I think, in Antigua for like a
Oh, wow. Nice.
couples trip. I remember this as I know I'm good with dates. I remember stopping my birth control in March. Didn't think anything of it. So a week goes by. I called two of my OB friends. "Oh, take a test when you feel like it." I paid it no mind. My other friend was like, "Girl, take a test. Just entertain me." She said, "Just entertain me. Take a test." Girl, I took the test and I was pregnant. The
Mm.
night I found out, I didn't tell my husband because I was just like, "This can't be real. I got to go to the store and get a real mind you, I do confirmation pregnancies all the time.
You're
I
right.
knew I was pregnant, but it was just the mindset of like, is this really happening?
Right.
So I ended up going to get is it the first response, the blue one, clear blue? I think it's a clear blue 2-pack. It said pregnant.
Gotta get the two pack.
And that night I couldn't sleep because I was just like,
Oh,
what
wow.
is going on? And I remember telling him the next day, and that's when it's like, okay, we're gonna be a mom. And that's when I lost my mind, okay? Because literally, I felt that even though I was in medicine, it kind of it robbed me from enjoying my first
Yeah.
pregnancy. It's like my first pregnancy is bittersweet. I was grateful. It was during COVID, so much uncertainty, being away from family, and just that I never knew I was anxious. I think most people are good, like ambitious women are usually anxious, and it's the good anxiety, right? Just to be excited about things and what's next. But this anxiety robbed me to the point
Yeah.
where I couldn't enjoy because I just kept thinking about, okay, what am I going to spot?
Yeah.
Are we going to go to the doctor and I hear a heartbeat? It was just
Yeah.
always something. Then I'm praying against, like my prayers were so detailed.
Yeah.
I'm just
Yeah.
like, girl, you need
Yeah.
to enjoy this pregnancy.
Yeah.
But I really couldn't. I could
Yeah.
not.
Yeah, I'm right there with you. So we have parallel stories. After 8 years of being married, when the world shut down with COVID, we finally found out we were pregnant in May of
Okay.
2020. Okay. 34 at the time. And then we had my son January of 2021.
2021. Okay.
Yeah. Your first child, it was your boy or your girl? I couldn't remember.
My boy.
Your
he was
boy.
originally due January 2021, by the way.
Yes. When's his birthday?
It's November. I had him early.
Ah,
so remember.
okay.
So,
Got
you know, I went through a lot.
Yes,
so
yes.
I had him early at 34 weeks in November 30th, but he
Wow.
was due, I think, January 21st or
Yeah.
one of them dates in January.
Yeah.
He was due.
And he's thriving. I know. I've seen him
Praise-
online. Yes.
Listen, motherhood reaffirmed my faith.
Oh, yes.
We can go like this. I know we want to talk a lot about the wellness, but when we talk about first time pregnancy, and of course, you know, we're gonna talk about being older and waiting, you know, because of course I got married later compared to my other counterparts who had kids.
Yeah.
In my mind, I felt like I was behind. So here I am with my first baby. Then it starts to become high risk.
Yeah.
And it just, first pregnancy shook me. When I tell you nothing prepared me, I don't care how much schooling I went to, all my attendings. To this very day, I argue with my attendings, telling them that they didn't prepare me for motherhood. They're like, well, that's something I can prepare you for. I'm like, no, even in med school, like none of the women attendings ever spoke about what it's going to be like being a mother and while in medicine.
Wow.
No one prepared me.
That is so good. And I always say that no one can really prepare you. It's such a unique journey. Like people can come in with the best intentions. Oh, you should do this. Make sure you do this when you do this. But nothing fully prepares you. And one part of it, it's like, dang, is motherhood or the motherhood experience a little gate kept? Like, are we not trying to scare each other? Because why aren't we?
Or we're just so in the thick of it that you can't share until after the fact, or it's just you're just constantly surviving and thriving at the same time.
That part.
I think that's what it is. Being a mom, there are certain things I tell my new moms, like I just keep remembering because it just when they mention like, oh yeah, versus me trying to explain to them unless they were asking me while I was in the process. And even then, there are times I couldn't explain things because you know the postpartum blues. There's so much that goes through first time motherhood, especially having like me, I having my baby early and just dealing with the changes. It was just like I don't know if we gatekeep per se or we just I don't think it's gatekeeping. I just think we just are in it. And we just can't explain it until after the fact. Like now that we're having the conversation, I can have the conversation with you, not breaking down, not crying. But before, a couple of years ago, I wouldn't be able to have this conversation without being level-headed and telling you, okay, let me go back and let me tell you how I felt. In the midst of it, I didn't even know I was like not with it.
Yes. This, you know what? This is probably going to be a better conversation than maybe the listeners may have been ready to get into. Because the thing about it is, and here's what I want to take apart from some of the things that you said. As medical providers, it's not always easier to be mothers, okay? When that first fever comes, when that you're still you're not in doctor mode, you're not in nurse practitioner mode, you're not in pharmacist mode or PA mode. You are in, oh my gosh, I'm a first-time mom. What is going on? Wait, what's the normal fevers? Like,
listen,
everything kind of just falls to the wayside because your maternal instincts kick in, and a lot of that anxiety and overwhelm we feel as providers, if there are listeners that are in the medical field, sometimes knowing too much is what actually does rob you of that joy. Because I personally experienced it myself. Doc.
Yes,
you are not alone with that. I experienced it myself. I even got a little tocometer, baby monitor that we started doing.
Girl,
the fetal monitoring at home.
Yes.
It's just so much, but a lot of it is when we get down to the science of it, and as we're going through it, we don't have the wherewithal, the strength, awareness of what's really going on biochemically. But now as I'm doing a lot more research, I'm thinking about, presenting really evidence-based heavy information for our listeners. Our brain goes through so much remodeling through the pregnancy process and into postpartum.
Yeah.
And another thing that people may not realize, even myself, as an informed medical provider is something called the postnatal depletion syndrome, which is basically because we lack magnesium and zinc and all these essential nutrients and elements because we're breastfeeding or because
Mm-hmm.
we're not eating enough because we're
Yeah.
just tired. We don't want to eat. We just want to, so because of that, of those lower level of nutrients, we actually have increased risk for the baby blues, the postpartum anxiety, postpartum depression, because our brain needs all those essential things to be able to regulate. It's so deep, Doc. Oh my gosh,
Yes.
I cannot
Yes.
wait to really get in because we've already given. We're it's so good already. Oh, it's so good already. We'll have time to continue to dive in because I think once we get into physical wellness, mental wellness is
Yes.
also very
Yes.
important. So here's another question that will kind of guide us back into the conversation. Okay. What is your opinion on physical activity and the importance it plays on our physical and mental wellness as mothers? There's the question.
Right. So most moms, right, we focus on losing the baby weight.
Mm,
Let's just hit it on the head right there. Losing the baby weight becomes the focus. And I think we negate that we need to take care of our bodies and not just focus on the weight.
mm,
And it's hard, right? Because we want to get back to who we were as a mom. And it gets frustrating, right? You're trying on clothes and things don't fit. And you have to say, you know what? This is my new body. Okay. This new
mm.
body, with a new baby. This
Yes.
body ain't gonna never be the same. I didn't
Yeah.
have a scar before, now I have a scar.
Yeah.
And I think it starts with, I always tell my moms, give yourself grace. So it starts with giving yourself grace. Before we even move into physical activity, I think it starts with speaking life over ourselves and giving ourselves grace to what we're going through
Mm,
first. Then when we tie in the physical part, I think the physical part is not just the losing weight part. It does help with your mental. It helps with improving, the dopamine and the like just all those neurotransmitters that we need to help us feel good. And even though when when you work out, if you know to work out, you're gonna feel better. You don't like the soreness, you don't like the stretching, but this, I find it when I exercise, it's about me taking time to pour back into me.
mm.
I know,
Yes.
and it may be different for everybody else, but when it comes to
Yeah.
me in physical activity and fitness, it says my body deserves to move. I have it. Two, I deserve to pour back into me because again, I'm being pulled, stretched from all places, and
Yeah.
that's just on the physical part.
Yeah.
And even on the mental part, baby, I need therapy. So I know you're gonna be on that too, but I found with fitness and like literally sitting with a therapist pretty much bridge the gap in regards to navigating motherhood
Mm.
because it's when we talk about wellness in that aspect, because wellness can be physical, mental, emotional, spiritual, but
Absolutely.
in regards to the mental and physical part, that was two: fitness and therapy. Fitness varies, right? I joined the gym. I was always one. I've always thrived in group settings, and some
Yeah.
people can work out by themselves. I'm
Yeah.
just naturally a person. All the times I've worked out, I've always worked out with groups
Yeah.
because it's something about being in community with another person.
Yes. Yes.
Yeah, God calls us to be in community. So I think it's just more of that too. But being in community, meeting new people, connecting on fitness, exercise, and motivating each other, it's very empowering. So
Yes.
finding a community, and it may not always be like a gym per se, but even like-minded people to help push you also helps empower you while we're navigating, finding ourselves and not just focusing on the weight. Like I said, most of us want to lose the baby weight, but once you get past the baby weight, you realize you feel better when you're moving your body.
Yes. Oh,
You really do.
yeah. I love that. You said so many really good things, and I want to try to extract some of those nuggets. Community, motherhood can sometimes feel like one of the loneliest things. Even though we're in a house with other people around us, even though we're going to work and interacting with our clients, our patients, all the people that we interact with day to day, but motherhood in and of itself can sometimes feel so lonely. So in order to combat some of the fatigue and some of the overwhelm with connecting with others while being active, it just sounds like the perfect recipe for healing. And I
It
just
does.
hold
Listen,
on, rewind, and adding therapy.
yeah,
Okay, that just sounds like the perfect recipe for healing. And I feel like one thing, thank you for being vulnerable. And the thing about this show, my goal was that we would build community so that motherhood feels less lonely, so that we could understand that our journeys are unique, but there's a common thread that holds us together.
Right.
So your vulnerability and, your wisdom affirms us. It is okay if you need an extra third party ear to talk things through that sometimes our spouses may not always are able to provide that or give us the ear we need or the affirmations we need, or our sister or our mother or our brother or our friends, because we don't want to trauma dump and we don't want to do all these things. So it
Yes.
is okay to find the help that you need in order to continue to grow and thrive. And there are even therapists that are actually postpartum specialists and motherhood
Yes.
specialists because
It's
they
needed.
know how hard it is out here.
Yeah. My friend is one, and it was so essential to have her. She
Yeah,
wasn't a therapist, but she was my friend, but provided comfort.
yeah,
I was shameless plug for Mama Heal Therapy. I got to
that's
connect
my
you with her.
girl. Yes.
That's your girl.
We need to get her on here.
She definitely gets to come on.
Yes, for sure.
And having that and is that reassurance, like, yes, she even helped me find my therapist. It's crazy because I had one
Wonderful.
with Sammy, but when I had the second baby, I said, yeah, I need to make sure I have this person already lined up as soon as I have the baby. And I
Yeah,
remember sending her
I love
profile.
that.
She's like, I like this lady. Her niches looks like perinatal. She's like, go with her. And
Love that.
I have been locked in with her since, and Naomi be 3 in next month. So,
That is amazing. So, holistic approach to healing, a holistic approach to wellness, like you said, mind, body, and spirit. And that's the pillars that I want to continue to build this community upon is wellness, mind, body, and spirit. So, to kind of just continue to go with that, as you are a medical provider, a family practice physician who sees patients anywhere from what we talked about was adolescents to geriatrics or our
yep.
senior citizens, okay?
Yes.
What are some of the most common health concerns or even red flags? Because it's all about red and green flags. What are
Yes.
some of the red flags you see in mothers, especially those juggling career, kids, and everything in between?
Wow. Very low. So let's start off with what I always see. I see moms, usually a lot of them, if they had their kids early on, they focus on their kids and they come see me when the kids are older and they finally start taking care of themselves. And this is where I'm catching everything:
Oh,
hypertension, diabetes, obesity. And it's just like, now it's time to, and they realize and they break down and say, I'm finally, it's time for me to take care of myself. I'm tired of taking care of everyone else. It's
mm,
time for me. I get
wow.
that mom. Then you get the mom with the younger kids trying to balance working and cannot find time to take care of herself. Always saying, Doc, I have no time. And I'm like, there is time. We just got to be better stewards of our time. I
Wow.
don't believe that God has not given us, He given us 24 hours. If we take a true survey of our time, we will find there is time to take care of ourselves.
Mm,
And many of them are not. We're taking care of everybody else but ourselves. Like, I
yeah,
kid you not. Everybody's taken care of. The job is taken care of, the kids, the man, everybody else but them. They're the
yeah,
last to get their screenings, last to get, even the prevented stuff.
right.
It's on the back burner until it's too late. So
Yeah.
most of my moms that I see, anxiety, the top conditions are anxiety, depression, top 2. I didn't realize how much psych I would be doing once I left residency.
Mm,
I didn't realize. I it
yeah.
definitely shocked me. Anxiety, depression, obesity, hypertension, prediabetes, all my top 5. That's
Wow.
my bread and butter. That keeps me booked and busy. I kid you not. Booked
Oh,
and busy. Okay,
that
those top
is
5.
that is eye-opening. So to break some of it down, for the women that you're seeing anywhere from their mid 30s to potentially 50s,
Late 20s. Yeah, you can say the
late
late
20,
20s
okay,
because
late 20s
they're
to 50s, mid
60s.
50s, 60s, okay.
60s.
So on the higher end, um the more seasoned moms finally the kids are in college and they're like, "Oh, I need to take care of myself." Then you have the moms in their 30s and 40s that are still in the trenches with the little ones that are just trying to like find time.
Mm-hmm.
Um and that's still not that's still causing some delay in care. And
Yes.
preventative care, like you said, that's our screenings. Like once we get to a certain age, just for our listeners out there, Dr. D and myself are licensed and certified medical providers. We the information that we're giving are evidence-based, but we always want to remind you to please follow up with your
Shut down.
personal
Say that again. Say
primary
that.
care provider or specialist that is taking care of your health.
Yes.
Okay, but the information that we will provide and are providing is accurate and evidence-based. Just had to make sure we
Yes.
got that.
Yes.
But so the on the preventative side, because that's so important, we're
Mm-hmm.
just talking about making sure, at least for those in their 30s and 40s, you're going in once a year to make sure you're getting a blood pressure screening, to
Mm-hmm.
make sure we're getting what we call a hemoglobin A1C, which Dr. D was talking about pre-diabetes. A hemoglobin A1C would allow for us to see where you are on that spectrum. Um,
Yes.
and if the numbers start to reflect a little bit higher, we're able to intervene. So the goal of preventative medicine and really having a proactive provider like Dr. D is so that we can prevent illness sooner than later,
Correct.
instead of catching it in the middle. Well, we want to catch it regardless, but we want to
Yes.
prevent it to begin with.
Yes. And even if
Um,
we catch it, the goal is to help mitigate further risk, right?
exactly.
So a lot of stuff I can just, if I start catching your A1C early, let's tighten up. We got to start making some lifestyle changes. And
Okay.
sometimes we have to add medication. I am not one to push meds
Yeah.
off from jump, but sometimes it's necessary. And I always tell
Yes.
patients there is always time. We can always scale back. We can always
Yes.
de-escalate care
Yes.
if you're doing your part. But yeah, it's a scale back medication because it's a thing. I know most people are like, I'm gonna get on medicine forever. No, you're not.
Mm.
Sometimes, yes, sometimes it is.
Yes.
But sometimes if we deem it's related to the way or how you're eating and you change that, yes, you can get off meds. You don't have to be on it forever.
Prevention is the key.
Yes.
Having a proactive provider that is on board with you, that is not
Yes.
necessarily going to push medication as a first line unless it is
Correct. Necessary.
absolutely necessary. But just to go over your top five one more time that you're
Yes.
seeing in the patients, the women that are coming to you between the ages of the late 20s into 60s, is
Anxiety,
anxiety,
depression,
depression,
obesity,
obesity, that's big,
prediabetes, and hypertension.
pre-diabetes or hypertension. And for those that may not know, hypertension is high blood pressure. Wow. Okay,
Yeah, those
those
are
are
my
some
top five.
serious red flags, and some of them could be preventable
Yeah.
based on lifestyle modifications, which we're going to talk about a little bit more, why physical activity works, then adding the component of what you eat, why that is very
Yes.
important,
Yes.
and how we can keep ourselves healthier as moms. We need fuel to get through these busy lifestyles. We need fuel so that we're, mentally present enough, because we're, if not getting enough calories or getting too many everything can be thrown off.
Everything.
Everything can be thrown off. So, really, why do you think so many women struggle to prioritize their health once they do become moms?
One, it's a whole new chapter that you've never navigated before.
Yeah.
Again, I don't care if you've been taking care of your siblings, you babysat, it's not the same when you become a mom. So you are charting territories you've never encountered before.
Right.
So here you are trying to balance yourself, the emotions, healing, because it depends, right? Not everyone has the perfect pregnancy. You may have to be healing from the C-section or just even a regular delivery with some complications. So you
Right.
have to do the healing of that, caring for a baby, and we
Yeah.
pray the baby is healthy, and God forbid the baby has, delayed in the NICU or just other issues. And then if you have a spouse or a partner, balancing their needs as well. And then on top of that, we're not done yet, right? You work here, okay?
Yeah.
You're on maternity leave,
Right.
right? While you take care of this baby, and then you have to go back to work and do all these things.
It's like a never-ending cycle.
It's insane.
It's insane.
People say there's balance. I'm gonna tell you there is no balance. Okay? I don't think balance exists.
Yeah.
It's my opinion. Do I think that there are some areas you're gonna be better in? Yes, but I don't think you're gonna be 100 across the board.
Yeah.
It's not possible.
Yeah.
That's just my opinion. If it works for you, great. But for me, there's no balance.
Yeah. I think that's consensus. A lot of people have been finding a little bit of they've been having a little beef with the word with the term balance. And a lot of people have been now adopting the term harmony,
Mhm.
trying to see how everything kind of intermingles within one thing. But it's true. Like, there's no way to fully give 100% to every aspect of your life. And I realize, especially for our listeners that are likely ambitious, high achieving, goal oriented women, we're so used to having control. Let's just talk
Mhm.
about it. Let me just say the word.
Say it. We
We're
checklist.
we're so
Go.
used to having things on a checklist, checking this off. This is done. Our to-do list is full, and normally we get everything done
Correct.
pre-motherhood. But
Yes.
then when you add this beautiful journey that we are on, that just gets thrown out the door. A task list, what is that? We'll try. I mean, I have
What
so
type
many
A? Type A. I'm type F now. I used to be very type A.
type
Now it's
F.
girl, I gotta get through 1 month at a time. Friend, what about girl? Don't stop. Stop right
Yes.
there. I gotta get through this right here. Don't add
You,
your anxiety on
you
top of me.
you're better than me.
I
I
just
gotta take things day by day sometimes,
literally,
depending what the season is.
I think it's so hard for us being goal oriented women. Once we put our mind to something, it gets done.
Yeah.
I could put my mind to something and it does not get done.
No. It just
You
falls
understand?
out of the mind. It's
It
gone.
falls, you forget it,
You
you
forget
drop
it.
the ball,
Yeah.
and it's just like,
It's hard.
what? And
Yeah.
I think it's so hard because a lot of us, I think when we are goal oriented, focus that. Then on top of that, the notion of that we are the cornerstone, right, of the
Mm.
family. Like we
Oh,
hold, it's the mother. The child wants their mother,
yeah.
and the spouse and the friend and the daughter. And just,
Yeah.
I think we carry so much, and it makes it hard that you're taking care of everybody else. You see the cup; it's everyone is you pouring water for everybody, and it is
Yes.
empty, and it's like, okay, there ain't no
There's
water
no,
for me to drink.
there's
How
nothing
can
for
I drink
me.
if I don't fed everybody else water? I
Yeah.
think that's what it comes down to as moms. Many of us are just we're giving everyone something to drink and leaving ourselves thirsty.
Mm. So basically pouring from an empty cup.
Correct.
So
The
how
cup
do you,
the cup is empty after you done poured
after
for
you done
everybody,
poured it
right? It wasn't always empty. It was not empty. You poured to
True, true,
everybody
true.
and forgot to replenish your cup.
I actually heard that analogy at a couples retreat at my church, and it was the same thing, like trying to pour into one another when you really just have to make sure you're getting enough from the source so that you have more and more to pour. And I think we as ambitious, goal-oriented women, we do a lot. We maybe have even been accused of being team too much or doing the most. And what ends up happening if we don't set boundaries or we don't incorporate things to allow us to have wellness overall, we end up spreading ourselves too thin and we burn out.
Yeah.
We
Yeah.
burn out. So, what have you learned personally about making space for wellness in daily life? Because it's a journey, baby steps, I'm sure, but
Yes.
what have you learned about that, making that space?
So let me give a little tidbit about my fitness journey. Well, I
Yeah.
remember, again, so I had first baby 2020, then I spun the block, had the second baby 2022.
202?
Mind
Was
you,
that 202?
202.
Okay.
I can't say I do not recommend. It's hard, right? I don't
Right.
regret it. It would be nicer to have family to help
Mm.
more. I like having mom, just a little bit more the village. And I still would do it because hence I'm able to travel. I can drop my kids off to Miami. So I'm grateful. I have some form.
Yes.
But I got to through Naomi, and with Sammy, I lost myself. I always tell people that
Yeah.
motherhood shook me to my core.
Yeah.
Again, I could talk about it now without crying and all the things because it took a while to really, one, allow myself to understand you never navigated this before. You're a first time mom.
Yeah.
You don't know nothing, right? And you're just learning along the way and trying to figure things out. Once you think you find a pattern that the baby switched the schedule on you, or
Right.
you think you got the hand and your breast stopped working. It's just
Come on.
you don't always get it. Second, and I lost myself. I remember just not. I don't think I did it on purpose. Just trying to
It
navigate
happens.
a practice, breastfeeding, husband,
Oh,
myself. I was stretched thin.
yeah.
And then I remember saying, I'm gonna give myself a year. We're gonna be done. And I was like, if I don't have this baby, we're not gonna have kids because we're gonna be one and done. But I needed another chance. And I always credit Naomi for giving me a chance to be a mom again. Because I tell you, with
Oh,
Sammy, I was super anxious. I didn't get to enjoy the pregnancy.
yeah, that's
I was
special.
robbed, but I was
Yeah.
redeemed with Naomi.
Oh,
Because
that's so
she drives me
special.
crazy. But with Naomi, I
Ah!
traveled. I was able to focus on Sammy and not even remember I'm pregnant because I was like, you know what? I have him. And
Mm.
if I seen what God did with Samuel, that means he's going to do the same with Naomi. So, like I said, my faith
Mm.
was further strengthened with Naomi. So I remember Naomi 7 months, and it was after my birthday. I just turned 36, and I was just like, I'm just tired. Like I'm exhausted. I just can't. There has to be more than just existing like this.
Mm.
And I remember saying, I had to remind myself, what did I usually do? Like I've been in residency, tired, busy in med school. What kept me going has always been fitness. And I didn't realize that until later now. That has always been something that kept me busy. Yes, I've always been in church. I've always had a spiritual aspect, but physically, what kept me going, get me energized is exercising. So I remember one day I was passing by my gym and I realized there was a gym by my house. I pulled up right after work with my scrubs on a Friday afternoon. Pulled up and I said, sign me up for 6 months. They looked at me like, huh? I said, yeah, I'll be back. I'll be here tomorrow morning. And then
Wow.
that I credit burn. Yes, it's more than just a gym for me, but it helped me find Fran again. And then when you talk about
Mm.
losing that vibrancy and after having kids and losing yourself, it helped me find myself just by saying, I'm going to start my day with me. I'm going to
Mm.
prioritize
Oh.
me. Before everybody want to before I give everybody something to drink, I'm going to drink first, right?
Ooh.
And that is what fitness has done for me. Just taking
Wow.
that time to say, I'm going to pour into myself. I know people think, oh, she's just being cute, you strong. This, no, 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 no. When I'm in the gym,
Mm.
I cannot think about medicine, them kids, or that man. I
Mm.
cannot. Because one is early, okay? I go
Oh,
very early.
that part.
Listen, it ain't for everybody, but I know that's the only time I have for myself that
Ooh.
is uninterrupted. So it's before the kids, before the man is fully woke up. I get up, I
Yeah.
go, I laugh, I have a good time. And I'm challenged myself in the gym. And then when I leave, okay, and it's back to mommy mode, getting
Right.
breakfast ready, getting things. But at least I know I started my day where I said, hey, before I give time to the job, or everybody else, I am going to move my body. One, it gives me clarity and it gives me energy. I've been up since 4 and it's about to be 9. I'm not yawning yet. I should be asleep though. This is my bedtime. But it's just a testament of me having more energy because I'm taking care of myself.
Lost for words, but here, let me try to get myself back. I start the day with me.
I do. And of course the Lord. Let me give God a word of God first.
No,
I wake up, I say,
yes,
thank
of
you,
course,
Jesus.
of course, of course.
Okay, so
But
remember that.
yeah, yes, that's important for our spiritual wellness. Yes.
Yes,
No,
yes.
but that is so good, Dr. D, because I don't think that, well, let me rewind a little bit. We lose ourselves in motherhood. Maybe not everybody, but
Yeah.
for a lot of us, there is a complete identity shift.
Yes.
And for a lot of high achieving women that are used to planning their whole life out since they were 5, in your case, for me, I was probably like 8 or 9. I knew by this age I was going to do this and I was going to do that and I was going to do that. And when and we're able to control, in quotation, so many different things, right? At least that's what we think. But motherhood is something that is so unexpected, like the journey, what you really go through mentally,
Yeah.
physically,
Yeah.
emotionally, that it can completely take you off guard. And because of all the other biological things that are going on outside of just the emotional impact that the challenges that we encounter can have on us, it just shakes us. It just shakes us. So you being able to find or remember, because a lot of it is about reclaiming
Yeah.
those aspects of your life that are still the core of who you are, despite all the shifts that happen when you become a mother or through your journey. But the fact that you were able to remember after all the fogginess and cloudiness,
Yes.
I'm right there with you. I don't really remember my son's first year of life. It was just, I don't know. It was a lot. After all the dust settles and you remember, you take the time to remember who you are. You're like, okay, I like this. I like to work out. It helps me. And there's so many physical and I should say positive things that working out does for us that it's just amazing that you're able to just recognize that in order for me to be better for everyone else, I have to start with me. I have to
Yep.
drink from the cup first. And it's not selfish. So that's
It's
why I
not
really wanted to have a conversation, Dr. D, about that. Is just kind of debunking some of the misconceptions about self-care and physical wellness as a mom.
correct. I say this. Some people say, "Oh, doing my hair, doing my nails is self care." To me, that's grooming. Okay, we
Oh,
got to groom ourselves.
ooh. Okay, yes.
But
Okay.
but this is my definition. I'm
I
not
love
saying
this. I
it's
can't wait
not
to
self
hear
care,
it.
but I honestly would say doing our hair, our nails, making sure we're put together is part of grooming. I'm a
Mm,
professional. I have to present myself. That's not self care. That's part of grooming.
mm,
But taking the time to say, "Hey, I'm going to eat right. I am going to pour into me." I find that to be self-care. Me saying, "Hey, I am not going to entertain this. I'm going to bed early. I'll catch you tomorrow." That's self-care to me.
mm.
And that's just my opinion.
Yeah.
Because again, I'm not knocking the girls, because many of us get our hair and nails done, and inside we are still not okay.
Mm.
We are still not okay. So at least for me, we have to get past the, if I take 15, 20 minutes to myself, it's going to affect the kids. Or I'm being selfish. No, no. Sometimes a mother, you got to be a little selfish. I say
Mm.
this, that it's not martyrdom, it's motherhood. No one's told us that we
Mm.
got to be martyrs for the cause of motherhood and just deny
Yeah.
yourself. No, no, no. Jesus did that. Thank you, Jesus. But we as moms need to start taking care. And I think a lot of it starts because we didn't see it growing up. And you and I are of the same culture. I didn't see my mom working out. And it's not because she didn't want to, it's just because she felt like she had to take care of us, work, keep the house, cook, do all the things. But I didn't want to be like my mom. And my mother, I'm a lot like my mom in a lot of things. Even my husband says this. But one thing is, I said, I am going to take care of myself. I remind my mom now, I said, "Mom, we grown. We are not your problem." She's like, "Mom,
Mm-hmm.
Mom," I said, "No, mommy, we are all grown adults. We have to live with our choices. This is your time to live."
Yeah.
And it's a reminder when I tell my moms, I said, "Hey, 10 years from now, you're going to be begging for that child to call you. And you're going to do all this, forget yourself, just for them
Ooh.
to all turn out to be ungrateful." So, and if they won't be ungrateful anyway, okay? And I'm speaking as an ungrateful child. I should be calling my mother more.
Yeah.
You deserve to take care of yourself. You deserve 15, 20 minutes to pour into yourself. And I'm not saying go to the gym. Fitness is more than just like sweating, but it could be a walk. It could be taking you
Mm.
to sleep. Because again, if you're not sleeping, your stress, your cortisol is high anyway. You're high in
Yeah.
stress. So
Ooh.
taking time to rest, taking time to sleep, meditation, stretching, these are all different things you can do. And even the most powerful thing you can do is walk. You
Yes.
take a walk. You're gonna you'll get your heart pumping, get your
Yeah.
mind clear, and I even tell my mom, "This take the kids with you. The kids need to see it. My kids know when they see my work. Oh, mommy, you gonna go work out?
Yeah.
Yes, this is."
Yeah.
So I have to encourage moms to understand it. You're not selfish for saying, "I'm gonna take time to do something for yourself." And I treat it as an appointment, just like we're goal driven. Girl, I book that my gym time is on my calendar. I schedule it, and I love that my gym makes us book camp so that you know you're going to show up, right? Because you make an appointment. We don't like missing appointments. Like
Right.
if it's on the calendar, and 9 out of 10 times it gets done. So that's how I treat it. I treat it as an appointment, and I encourage my moms to start treating it as such. You make all the doctor's appointments for the kids. You make all the deadlines at work. Make prioritize that time for you, even on your lunch break. Use the time. If you have an hour, don't sit at the people desk and do the work. Get up, eat for 30, walk the other 30. I just find ways to say, "Hey, we gotta find ways to make it work, even in the midst we think we don't have time,
That's
because we got time."
It, it's true. We do have time. We definitely prioritize what's important, and wellness should be a top priority. I love how practical that advice was, as far as even if you have an hour lunch break, if you are privy to have an hour of lunch that you eat for 30 and then you walk for the other 30 minutes, that is phenomenal advice, because I don't think that we look at it. I think, in the midst of our overwhelm, it's easier for us to be like, no, no, I
I
don't,
got
I
time.
don't have time. I
Yep.
can't, I can't. But when we make the time or prioritize ourselves and understand the global impact, the long-term impact of moving our bodies now in our 30s, our 40s, even our
Yes.
50s, how it can impact us when we are later in life.
Yeah.
And I love those. It's baby steps.
Yeah.
So would you say that for those that may wonder, well, how much activity is enough? If I'm just gonna walk, well, how much walking is enough, and how hard should I be walking?
So current guidelines recommend at least 150 minutes of some moderate aerobic exercise, which means getting your heart rate up, right? And then also incorporating, I want to say at least 2 days of some strength training, which means using
Okay.
weights. So that's a big new move
Yeah.
compared to what I thought about exercise up until the last couple of years.
Yes.
Is everything was cardio, cardio, cardio.
Yeah.
Now everything's moving towards like, oh, we need the both. And that's why I love science. It's always evolving, right?
Yes.
So
Yes.
yes, we still need the cardio, right, to get our hearts pumping and vasodilating the arteries and all that good stuff. But we still need that strength training because we need our muscles. We need to build the muscles around our bones to help them because as we age, our bone mass goes down, especially as women. We're gonna start. Girl, we have to do a whole nother conversation on perimenopause. We're gonna find that that's a whole nother conversation for the geriatric mom. But building that muscle mass helps with insulin resistance. That muscle mass helps with strengthening around the bones to help with as we gradually lose bone mass. So if you can at least dedicate 150 minutes in a week. That's 30 minutes 5 times a week.
Okay.
Is what the minimum that's recommended. 150 minutes. And with that, like I say, is moderate. It could be walking, it could be running, it could be the incline, the elliptical. I don't use machines as much anymore.
Okay.
But on top of that, adding some strength training at least twice a week, you're good. And if you want to do the Pilates, girl, fine. But you still need to walk.
That's trending. That's trending.
That's trending.
The Pilates.
I get it, but you still need that cardio a little bit. But not, again, we don't need to be as cardio heavy. The shift of cardio heavy, we're moving away from that. Because again, I think when we think cardio is just running, walking, strength training also helps is part of cardio too.
Yes,
because you get your heart pumping when you lift weights as fast. Yeah. Understanding that we're not just doing straight running or walking. Yeah. It's also not being shy of those weights.
Oh, that's good. So at least having 30 minutes of moderate activity 3 times a week and incorporating some strength training
to get us to give us to like 150 minutes a week.
Got it. Okay. Exercise. Got it. Okay. Yes. And I love that you said that medicine evolves. And it just makes me think of just life in general and our journey as mothers as we continue to evolve and what it really takes mentally for us to kind of keep up with the trends, with the things, with the science. Yes. And another thing that is shifting is how we approach a woman that has children later in life. So I did a play with the title of this podcast, of this show, because I wanted to kind of poke fun at society calling us geriatric moms. Okay. So that's basically someone that, from what I understood prior, someone that becomes pregnant at the age of 34 years old and then has the child at 35, 35? Or is it right? Or 35 and up, I think it is now.
Yeah. But advanced maternal age.
Now the term, that's what I wanted to get to. That's what I wanted to get to because I wanted to like ruffle a little feathers. The whole purpose of it is so that we can debunk those societal myths. We can debunk some of those societal constructs that kind of limit what women are doing. Like women are having children later in life where our life is lifing and because of work, education, finding love at, later in our 30s, 40s, or 50s. This is why the times are changing and why women are becoming mothers, whether they're having the babies themselves, surrogacy, adoption, have an IVF journey. All of these things are moving with the times because of so many different factors that affect when we're becoming mothers or going on this journey. How does age or being considered a geriatric mom, but now we know the proper term is advanced maternal age, play really into maternal health and what is the truth really about having children in your 30s and up?
As you stated, a lot of us are having kids later. And the myth is, oh, you're automatically high risk. It's not always
Let's
true.
talk about it.
Yes. Is there a risk because they're 35, but they're more likely not to still have a good pregnancy. And I think many times we just see so many bad outcomes because that's what's usually always put out there, but that's not always the case.
Okay.
But that's a common myth. Like, oh, you're 35, you're bound to have a high risk pregnancy. Things
Right.
are going to go wrong. Mainly, no, they don't. Not always. I know so many people who have had kids up into 39, 40. My sister-in-law had her last baby close to 41.
Yeah.
It was fine.
Yeah.
But then again, I'm not going to deny that we're not going to, because even if you, and some of the high risk happen even with not having them early, you can still get preeclampsia. You can still
Right.
have postpartum hemorrhage. You can still have
Right.
postpartum cardiomyopathy even before 35.
Yeah.
So I want to caution women not to feel like that their clock is ticking. Yes, you desire children. I think something that I remember in residency they taught us or even encouraged us to do was freezing our eggs. Because we want to
Let's talk
as
about
much
it.
preserve fertility. But some women don't do it and still get pregnant fine.
Right.
So I think if this is truly your desire and God grants you that desire, I wouldn't let age be a reason to stop you. Now, I think it is one, you should be getting good medical care, right?
Yes.
Making sure you're dealing like as you're aging, you know you're likely to maybe succumb to comorbidities, but making sure you're doing your prevention, right?
Right.
You're seeing your doctor, you're having these conversations, so you're making sure you are in as healthy as possible when that time comes for you to conceive, even if it's after 35.
I love that. So many good things that you said there. I personally have several friends that have made such the courageous decision to freeze their eggs. And because the desire to become a mother is so great, but because of all those external factors, that could, I don't want to say hinder or delay, because timing is divine, I should say, right? But that causes it to happen later than expected. The egg freezing process to me is such a courageous, audacious, and beautiful thing and option that I guess modern medicine allows for women to still be able to embark on the journey when it's time. So I love that you mentioned that.
Yeah.
The other thing is that even though biologically we have a lot of things going on, I love that you said that kind of preparing your vessel, your body, your mind, making sure that you're getting the right type of prenatal care, even if you're just considering it.
Yeah.
Whether you're considering trying to conceive within, a 3 to 6 month span, normally, you kind of prepare your body by taking prenatal vitamins, by eating better, by abstaining from alcohol, by maybe even getting a perinatal, like you said, counselor that helps you mentally prepare to conceive.
Yeah.
I think that is so imperative, Dr. D. And I love that you made such imperative points about preparing and encouraging our audience that it's not too late. We don't need to abide by what society says. We understand the importance of the evidence and the science and the biology. But especially if you're a person of faith, anything is possible. Anything is possible. We spoke so much already about tips and, what's important about wellness. Maybe one more thing I'd like to talk about before we get into a really fun area of our show, part of our show, is food, the nutritional aspect. So we have the physical activity, we know the recommendations. Do you have any input that is practical for busy moms that are trying to also eat well, understanding that you could work out all your life, but if you're not adequately intaking a balanced, nutritious diet full of fruits and vegetables, it's like
Wasting time.
pointless, a waste of time. Yeah. So tell me
I
more
would
about
say
nutrition.
you cannot there's a saying, what we call in the fitness world, you cannot out train a bad diet. You cannot, no
That's
matter, it's just what it is.
yeah.
Um, and you said it earlier that we have to learn how to fuel our bodies.
Yeah.
You and I come from, I'm going to say, the starvation culture, right? In
Yeah.
regards to just ripping and running, not eating, and
Yeah.
just, living off whatever, coffee and
Yeah.
junk.
Yeah.
And I learned in my fitness journey, I had to eat. If I wanted to
Mm.
lose the weight, but I'll not just lose the weight, but feel strong
Strong.
and
Yeah.
be able and be as productive, I had to look at food as fuel. Because for so long we thought the aesthetic of losing weight meant starvation.
Starvation. Yeah.
No, it means eating, but make sure we're also eating well. It's so much to get into because, as I said, I there's a lot of stuff online about what people should eat and how they
Yeah.
should do it. One, I say, get your nutritionist. Stop
Okay.
looking.
Okay.
There needs to be space to for expertise. Like we
Mm.
cannot. Everybody online ain't no nutritionist. Everybody online, a lot of people just influencers will just put words out there and
Oh,
just
that
think it's
part. Talk
right.
about
I say get down to, let's get back to our experts, meeting with nutritionists, getting a meal plan catered to you, understanding what caloric deficit you need to be. It may vary between me and you.
it.
So
Right.
I can't tell you, oh, you need to eat 1,500 calories. Says who?
Yeah.
That may not work for you. It may work for me, or it may not work for me and it works for you. So I
Right.
think taking that time to sit with a professional and really understanding what that means, right? So one, eating our food. As much as I love my Haitian people, I love our food. I do. But it has not been conducive for me in my current wellness journey. I
Okay.
still eat my food, right? There's still balance, but there is an emphasis for me to prioritize veggies, fruit, protein,
Yeah.
and limit as much processed food. And that's pretty much Haitian food. I feel like in Haiti, we did more whole food. This is more
It's
in the
true.
States. It becomes more processed in that way.
Yeah. Get it.
But for me, it's really taking the time to really prioritize that, right? I still eat rice here and there, but it ain't every day. Or if I
Got it.
do, it's
Right.
the portion. And
Right.
many times, it's not what we eat; it's our portion size could also be playing a role.
I see that. Yeah.
Really learning what we should be eating, right? Everything ain't gotta taste good. That's one of my things when it comes to I tell my patients. You know what it tastes like already. You ain't missing out. And that's, but I don't. Yeah, I can't. I say yes, you can. You know you ain't missing nothing. And I always tell them that every meal does not have to be an experience. And that's something, and my patients look at me like, "You're right." And I was like,
True.
"I know."
Yeah.
Because we got to make it make sense. Sometimes it's really retraining our mind. The Bible talks about it, renewing our minds and just really changing our mindset on food sometimes helps us. I'm all for working out great, but if I'm not eating right, I'm not getting enough caloric intake, I'm not drinking my water,
Yes.
right? We're relying on our calories through sugary drinks. You're not going to feel as great if you're not fueling your body correctly.
Yes.
Yeah, let's stick to that. Right. And that takes time. Because
Yeah.
when I first started working, I didn't know that. But my trainers are literally teaching me how to eat because I'm like, I just thought just that you didn't eat. They're like, no, you need
Right.
to eat. You need to eat because you're gonna be famished. You're not gonna feel strong
Right.
because the body needs fuel. I don't leave the gym. Like I look at fuel in my body as putting gas in the car.
Yeah.
You can't drive with no gas.
Right.
So you gotta give fuel. Now you're gonna give good gas. Like so you're not gonna put diesel in a car that needs 93,
Right.
right? So it's just learning it's just a science too. It's not just just see what that person does for you. No, no, no. I think if you keep it basic, it can work. These carbs and just knowing the amount,
Yeah.
but I can't tell you what was going to work for you. I
You're
think we
right.
have to go back to meeting with a nutritionist, and I can't even say speak with your physician. A lot of us don't have. Some of us do, but not all have experience when it comes to down to nutrition. So we'll just tell you. A lot of us, I think, a lot of us played a role and just saying, "Oh, diet and exercise." What does that mean?
What does that mean? Yeah. What does
What
that
you want?
mean?
What does that mean?
What does that
And this
mean?
is when
Yeah.
I say, you know what? Let me connect you with a nutritionist. And patients
That's
will come back and
amazing.
tell me, Doc, thank you. I met with a nutritionist. I've got them. I've understood my foods, and it makes all the difference.
Anyone listening out there, I mean, hopefully you had a pad, a pen, a paper, a laptop, a something to. This is so much wisdom, and this is coming from a board certified physician that's imparting so much knowledge, not only from her professional standpoint, but also from just being a busy mom that had the desire to reclaim her identity and her sense of self and to have the energy to actually keep up
Yes.
with the children that
Yes.
she's blessed with. So that's one thing too, as we're navigating into our 40s and beyond, we always talk about our knees are hurting
Uh,
and
they
all
are.
these kind of things, but if we implement just simple little things that allow us to be active and move our joints and
Yes.
slow the process down of aging and
Yes.
bone loss, it's
Yes.
already that it's already written for us. But if we could potentially slow those things down by intaking adequate nutrition and vitamins and getting active, I mean,
Yes.
I think it's just going to be so much better. And then our children will have this legacy of
Yes.
activity because they're seeing that mommy did it and I can do it too. And it just goes on beyond that one decision to
Yeah.
to do this for ourselves. Our kids see it too. So,
Yeah. Real quick,
whew, yeah.
well, you asked me about some quick tips. So I would always encourage, if you can meal prep, I say do that.
Okay.
Not saying you may rely on fast food, but many times if you have stuff with you,
Yeah.
you're less likely to reach out. So
True.
I say packing the apple, packing the fruits, finding, like, they have little chicken and different, like, little, there was like Lunchables, but they almost do like
Yeah,
little
sure,
packets.
sure, sure.
Packing those high protein snacks, getting a good protein bar, look and reading the labels. I think that's another thing too. We got to read the labels. That's
Right.
another. You got to get a nutritionist on here. They just finding small practical snacks you can pack in your bag, so that way, if you want to reach for something, you have something already with you.
Right.
Keep the protein shakes in the bag, in the lunchbox, right?
Yeah.
Just because we know we're busy. But I find that when I pack my snacks, I'm less likely to snack on something I don't have no business need to be snacking on, especially when
Understood.
it's not part of my journey. Not saying I don't believe in being extreme, but when you have a desire to get somewhere, sometimes it requires some discipline, and that's part of pre-plan.
Ooh, that's big.
So doing some meal prep when you can, packing the snacks, packing the yogurts,
Yeah.
just making sure you have things with you so you're not just, when you're starving, reaching for anything.
Right. I love that. I love that. So much good stuff. So much good stuff and so good, so good. So we've come to the part that is one of my favorite. Maybe my top favorite, but then the other part right after it is really
Yes.
really good too. But our millennial nostalgia break. Okay, we're 80s babies
Yes.
that grew up in the 90s and early 2000s.
Yes.
Okay.
Yes.
So a part of this show is embracing that culture that we grew up in,
Yes.
and how it really is making us the fun moms. I feel like the fun moms that we are
Yes.
today. So tell me a little bit more about your favorite millennial memory, whether it was the music, the fashion, concerts. Let's
So,
go down memory lane.
I grew up in a very conservative Haitian home. So, baby, we
Okay.
ain't going to no concerts, okay?
Okay.
My concert started when I got older.
Yeah.
But Boys to Men was my childhood
Oh.
favorite boy band. When I say
Oh.
love Boys to Men,
Yeah.
I would try to write to them. Fun fact, when I went to med school in Nashville, they played at the symphony and I got to meet them. And I kid you not, it was my first experience of what someone like feel like, meeting their band crush, and
Yeah,
just
yeah, yeah.
I listen, like,
You're
I
fangirling.
could not believe it. I
Yeah,
took a
that's
picture with Boys to Men,
amazing.
but to know that, like, they were at the symphony was such an amazing concert. And I
Love
remember
that.
paying, we had to run across the street to get an ATM, pay extra for the meet and greet. And I kid you not, it is one of the most nostalgic moments ever, is
Ah.
meeting Boys to Men. And that's for the American part, right? Yeah, I'm still Haitian.
Yes.
And the other one is Kaimi. Listen,
Okay.
I flew to New York for one day just to see Kaimi's first concert. And it was worth every dollar.
Oh,
And
love
heaven.
that.
It just brought back so many memories because, Haitian music is what helped me really speak more Creole
Okay.
and really embrace the culture.
Yeah.
So Kaimi is one of my favorite bands. I have Boyz II Men and Kaimi, those two. Whenever I hear their music, I remember, like, okay, I wasn't this great. I wasn't that great.
Oh, yeah.
Yeah.
I love that. And I'm so happy that you got to do that. Music
Yeah.
is so imperative to a lot of our core memories.
Mm-hmm.
Just, the little start. I saw this the other day on Instagram, and it was a girl that she did a compilations of, millennials when millennials here, and it'll be like the start of like a song,
We already know.
like we'll just hear something and we'll be like, okay,
Or
Our
like
antennas are
going
on.
up,
Yeah.
like,
And we're running. We're running wherever we are. We could be
yes.
at the grocery store.
Songs, they play, you would not know I'm a doctor because,
I'm telling you,
yeah,
I'm telling you,
yeah.
I'm telling you. I love that. Oh, thank you so much for that. That was actually a really good memory for me. And that's the thing about remembering
Mm-hmm.
this woman we were and honoring her and making
Yes.
sure that ever so often we're doing things to kind of just bring back that joy. And
Mm-hmm.
I love it. So here's the reflection part of our show as we wrap up.
Mm-hmm.
So as moms, as busy moms, as first time moms that have navigated baby blues, that have navigated possibly postpartum anxiety or postpartum depression, we're harder on ourselves because as high achieving women, we have always been able to just rely on this perfectionist spirit. That's what I'll call it, to
Yeah.
say the least,
Yeah.
right? And we don't always operate with grace. And every opportunity that I have, I want to remind a new mom or someone considering motherhood or someone in the trenches that just feels lonely, operate with grace and self-compassion. It's
Mm-hmm.
so important to love yourself and give yourself, extend the same grace you would extend to others, that you're making sure that you're extending it to yourself. So
Yeah.
if you had the opportunity to tell the version of yourself that was a first time mommy
Oh,
something that would make her proud now, what would that be?
oh my goodness. One, I would hug her.
Mm,
Okay. She would get a big hug and just a reminder that it gets better.
mm,
And then again, to remind her that God never forgot you.
mm.
Because I remember being, it's the emotional part of me. I remember like being pregnant and just like, holding on to the hymns. And it was one song was like, I was saying, Lord, don't pass me by. And it's a reminder He didn't pass you by. Oh, I would tell her that it all works out, that you were called to do this,
Mm.
and that the children at the end of the day are His,
Yeah.
not
Ooh,
yours. And I'll hug her again. Yeah.
special. And I'm just sitting in this
Yeah.
moment because that is so sacred. That is so beautiful. I love that we have a chance to talk to her because sometimes she felt like she wasn't doing enough.
Mhm.
She felt like she was failing. She felt like she questioned what she was even doing sometimes and how did she get here.
Mhm.
But for us to have this awakening as the days get a little better day by day, if you're out there and things are a little bit tough right now, just know you're not alone. Just know that there are resources and people that you can reach out to so that you can get the support that you need, whether you're a geriatric mom, a young mom, a single mom. And if you are a mom that believes in God, the children are His,
Mhm.
and you are equipped with everything you need in the deepest part of your soul to take care of them once you live a more surrendered life to this role. I'm trying not to cry, but Dr.
Yeah.
D, you really, really, really touched home because a lot of us may not remember, those emotions, or we don't dig deep into it. That's why I'd like to do this reflective point so
Mhm.
that we can just know that it's going to be okay and that we are doing the best job that we can.
Mhm.
Woo! Listen, I don't know about you, but I feel so full after this conversation with such. Now I'm going to give you your flowers. I have been inspired by you from day one. We definitely met in a social environment, and I just
Yeah.
loved how you just were enjoying yourself. And I think you probably were in residency by then, or
I was.
yeah. So you still carved out time to just have a little bit fun and let your hair down. But as we had parallel motherhood journeys, I was so inspired, and that's why I definitely wanted you here, not only for your medical expertise, but just so that women know that it is okay to prioritize yourself and your wellness. It's okay to feel strong after maybe feeling weak,
Mhm.
or society may have made you feel weak. Ma'am, you
Mhm.
are strong. Mama, you
Yeah.
are strong. You are doing it. And there's ways that you can continue to build your strength physically, mentally, emotionally, and spiritually. You just have to carve out that time. So thank you again
No,
for
thank you.
just being a pillar of light, of hope, for pouring into patients, for speaking over them, for giving them a second chance at thinking that they can still continue to live a thriving life and that it's not over. Life isn't over if they do have a diagnosis. But with good partnership with the right provider, you can continue to thrive and regain your wellness. So I just want to thank you again. And where can people stay connected with you? We need to stay connected with you. You need to see her in the gym at 4 a.m., sweating it out and lifting all this weight and
Girl, fighting
pulling
for my
tires.
life.
And where can
Fighting for
where
my
can our
life.
listeners
They can, well,
stay
for
connected?
now, you can connect with me at Fran the Mom Doc. So Fran the Mom Doc. And I changed my name because before I was Miss Fran, but the kid having children redefined me. So
Mm,
that's why I don't care what happens. I don't think I can ever change my handle because part of the Fran that people know now more was because of motherhood.
mm,
So Fran the Mom Doc, you can find me on Instagram. That's really where I am
yeah,
now. I did that on TikTok. It's just finding the time, and I just
yeah.
can't. But I'll give you what I can. I at least show up. I'm at least going to encourage you to show up and work out. I mean, I be getting up at 4. I don't. I disclaimer. I do it because it's the only time I have right now.
Yeah.
But the Lord knows He's going to deliver me from that time. And He knows my
That
time is not always 4:30. It's temporary
that
in the
part.
season that I am. So,
Okay,
like I
I'm
said, that's
touching
to
and
encourage
agreeing
you.
with you.
Sometimes in certain seasons, you got to get a little more disciplined and be a little uncomfortable.
Yeah,
But I know that I don't want to be 4:30 forever. This is just
yeah.
right. Okay. Find me, connect with me, ask me questions, and just be encouraged that I look like you. I'm another mom like you who is just navigating life.
What a beautiful journey that we get to do together. Do together. Ah, my goodness. As always, thank you for tuning in to Musings of a Geriatric Mama. Don't forget to subscribe and share this very impactful and stirring conversation with another mom that needs encouragement. And join me next time for another empowering conversation. Thank you and take care.
Bye.